Welcome back. The Maharashtra government today has announced that it will be extending the timings for shops and restaurants to be opened in the state. Currently, there is a deadline of 10 p.m. for shops and restaurants in Maharashtra because of COVID-19. This is about to be extended. They will also allow amusement parks and concert halls actually to open from the 22nd of October. My colleague Mayuresh has more details.
Absolutely, because these shop owners as well as restaurant owners are asking for the extension of this particular timing. Right now in Maharashtra, you can keep your shop or the restaurant open till 10 p.m. But these shop owners as well as restaurant owners were asking for extension at least till 11 or 12 because their logic is that people do come in the restaurants for the dinner post 8 p.m. And that's why there has to be some kind of extension the government should give. A lot of delegations have met the different ministers including Maharashtra CM Uddhav Thackeray. But today, after having the meeting with the COVID task force, Maharashtra government has taken this decision that there will be an extension of timing which will be given for the shops as well as to the restaurants. But but what would be that timing? They have not disclosed. From 22nd of October, this will come into the place. So we are expecting within next 2 to 3 days, the new SOPs will come where Maharashtra government will tell that what exactly is the timing, whether it is 11 p.m. or it is midnight 12.
All right, Dr. Shashank Joshi, Dr. Rahul Pandit, both members of the Maharashtra COVID task force with us on the show today. Dr. Ashutosh Raghuvanshi, also with us on the show. He's the MD and CEO of Fortis Healthcare. Welcome, gentlemen. Thank you so much for joining us. Over the past nearly 2 months, 2 years, we have spoken several times about how we have to fight back COVID-19 and how it looked like gloom and doom for several weeks. Dr. Shashank Joshi, let me begin by asking you, when we have registered 0 deaths for the first time in Mumbai since March of 2020, and then we're seeing other signs of improvement, not just in Mumbai, Maharashtra, but all over the country as well, does it seem like the worst could be behind us? I mean, we're all set to cross 100 crore in vaccinations, perhaps as early as tomorrow.
Tamanna, thanks for having us. Very clearly, we are past the second wave now. We can say that, I think, with a lot of certainty. We had tough 20 months. And clearly, we can see North India, the wave had almost gone a couple of months back. But Maharashtra numbers are dwindling down. Kerala numbers are dwindling down. Northeast is also dwindling down. So second wave is over. And there is a reasonable degree of vaccination with almost 100 crore vaccine administered 1 dose. And also, to a great extent, there is a Delta herd immunity. Unless and until there is no new variant of interest or concern, it is unlikely that that so-called proclaimed third wave will actually come. And if at all it comes, it will come somewhere in probably December, Jan or February. And we can't predict it. Of course, COVID has been very unpredictable. But clearly the worst is over. As far as second wave is concerned, it is over. Mumbai still reports 300 to 500 cases every day. We have a TPR positivity rate between 1.3 and 1.5. We still are doing a lot of testing. We can't forget our basics. So there is no need to become complacent. We are still seeing a lot of breakthrough infections. Having said that, I think in geographies which are population dense like Mumbai, we may see COVID later on becoming endemic when pandemic is over. And that's something which we have to live with. Just like we have malaria, dengue, chikungunya, which have all sprung back now. We are actually weighted with those problems far more than actually COVID. And COVID also now we know how to handle it better. We have the advent of this lytic cocktail antibody, which has clearly made a dent on hospitalization rates, critical care unit stress. So clearly the worst is over. There's no two ways about it. Definitely we are looking at better times, but people still should need to mask. It's an airborne droplet virus. We still need to ensure that we are in better ventilated spaces. We adhere to COVID appropriate behavior and protocols. I think there is no escape from that, at least for the next 6 months to a year.
Yeah. Dr. Pandit, I don't want to tempt fate and to jinx things because the second wave took everyone by surprise. And it was around this time last year that we were all thinking, chalo, it's done. But this time round, the difference is the rapid rate of vaccination and the fact that no new variant has popped up its head so far. And this vaccination now seems to be global. Does that give a greater degree of confidence?
Tamanna, good evening, and thank you for having us all. I think the biggest reason why any vaccination program is started out or rolled out for an infectious disease is to prevent deaths. I think we can safely say that we have reasonably achieved that target, at least, with the deaths not happening in Mumbai yesterday for the first time since March 20th of March 2020. I think it's a big achievement. Obviously, the number of deaths have also come down. Whether you look at the north of India, there are hardly any COVID-related deaths happening. And in Maharashtra as well as Kerala, the number of patients who are succumbing to the disease are going down slowly. Of course, we need to reach to a point where there are zero deaths. The point which you made is very, very, very valid. I think the difference between the second wave when it started and now when it is almost ended, as Dr. Joshi rightly pointed out, is that our vaccinations are touching 100 crore, which is 1 billion doses. It is truly a mammoth task for any nation to actually cross that number, which we are about to cross maybe tomorrow or day after tomorrow. And with that comes in the amount of antibodies and immunity which it provides, which obviously gives us a lot of confidence that even if the numbers do rise up, unfortunately, because you will still see breakthrough infections and nobody has the crystal ball to say when it will start. But we can definitely say that those who are fully vaccinated will have a very, very milder course of disease, and it will not stretch and batter our healthcare system as it did the last time. So I completely agree with your statement that yes, this time around the difference is the vaccination. No doubt about that.
Dr. Raghuvanshi, for the healthcare community and for medical professionals, what is the reading right now? You're, I'm sure, seeing lesser and lesser cases come in. I mean, the whole way the vaccination drive has moved post, making it free has also meant that the private sector has pretty much bowed out of the vaccination process. Are you seeing now an ease and a return to usual as far as the medical fraternity is concerned, as far as your hospital is concerned, more elective procedures now coming back?
Thank you, Tamanna, for having me. You're right. Private sector has not been so actively participating in immunization as in the beginning of the program, but we are nevertheless very proud of what the nation has achieved. As far as the non-COVID work is concerned, that is gradually coming back to near normal levels, and in some cases even exceeding that. So there was an early assumption that there would be some pent-up demand of some of the elective procedures, like, for example, orthopedic procedures or for joint replacement, etc. We are seeing some of that play out. However, the one segment in India which is significant is the international patients. We still are not seeing that coming back to normal, and that is totally related to the travel-related restrictions. Otherwise, all other specialities are near normal. One of the biggest tragedies of this entire pandemic was that a lot of treatments of other illnesses were delayed simply because either patients were fearful of coming to the hospitals or there were no means for them to get to the hospital. The hospitals were also not prepared early on, and they were inundated with the COVID work. So because of all those factors, a lot of patients did suffer. And I also believe that in many cases, some of those patients may have become inoperable, and some people may have unfortunately lost their lives as well. However, now the good news is that as the disease is settling down, the non-COVID work is resuming gradually, and we are seeing that becoming better month on month. One of the major things which we have noticed this year is that during the festival season of which has already started, the numbers used to go down for a lot of elective procedures. We are not seeing that kind of decrease in numbers for elective procedures this year, and they're remaining relatively near almost stable. So that indicates that recovery is almost there.
Yeah, possibly people want to not waste time, not knowing what will come next. Dr. Joshi, speaking about the festive season, are there real fears? Because the fact is, you go out on the streets, you go out in the bazaars, and people now can sense that the worst is over. People are becoming lax, crowding is taking place, and masks are being worn, but it's more perfunctory. It's not as strict as before. Can we see a bounce back in numbers post festive season, looking at the fact that the Delta variant is there in a lot of people and vaccinations are also high? So, is the chances of that now less post festive season as well?
No, I think we need to still be cautious. I think Delta is a different beast altogether. We know the infectious nature of Delta is quicker, faster, and airborne. So I think there is no room for complacency. Yes, festive season is around, but we still need to be cautious and careful. See what has happened in United Kingdom, in Europe, in Israel, and in United States. And whatever happens there, usually after 3 to 4 months, India follows. So despite of full vaccination with 2 doses in great geographies like US and Europe, they still got a backlash. So I think there is no scope for faltering on COVID appropriate behavior and masking. At the same time, festive season is around. We need to ensure that we celebrate it appropriately and carefully with all the protocols in place. Yes, there will be some degree of crowding, but if you are in crowds, wear a double mask. If you have a cloth mask, try to wear a 3-ply surgical mask. And if you are in a healthcare environment, try to wear an. We need to be cautious and careful. There is no two ways about that at all. And if we falter, we might get small little peaks. And the biggest challenge is unvaccinated population. There are still geographic pockets in India which are unvaccinated. There are still people who have single dose, and we still have an immunocompromised population. So the vulnerable group still needs to be cautious and careful. COVID is very much around, but it is significantly come down, and we must do everything to ensure that it stays down for the next 3 months to 6 months, or maybe forever. So that's an endeavor, and therefore there is no room for complacency at all.
Dr. Pandit, for the vulnerable population, for the elderly, for the immunocompromised who may have received 2 shots, are they still as safe, or is the case now for a booster dose increasing?
So I think that's a very important question. We know that the vulnerable population, especially who are immunocompromised or who are taking medicines to basically suppress their immunity, we know that they don't build up the antibodies in the same level as an immunocompetent person would. And WHO recently has suggested and recommended that people who are immunocompromised should probably be looking at taking the booster dose. I think India would be thinking in that direction as well. We should at least start talking about that and preparing about that. A lot will depend on our population getting vaccinated as quickly as we can and the availability of the booster doses for this vulnerable group of population. Because again, I come back to the same thing which I said before. We need to save lives. And the only sure shot way where we can actually achieve that target in some reality is by vaccinating as quickly as possible and giving these patients some antibodies to protect them. And immunocompromised patients may probably need the booster dose earlier than the rest of the population. And there is no doubt that it would probably be rolled out much more quicker than what we think of. However, the government needs to decide on that policy. We cannot, I mean, none of us know the timing of that right now, but we hope that on a scientific basis, a decision for that would be taken up soon by the NTEGI, which is the highest body which decides on that.
And we also have to remember that children are still not vaccinated. I mean, the Covaxin has gotten a preliminary clearance from 1 round for Covaxin for kids, but the final clearance, the green signal from DCGI, is still awaited. So we still have a large part of our population which has not been vaccinated at all and are going out there and continue the need to be protected. So we can't let our guard down. But yes, at least this festive season, we can celebrate that we have moved one step closer to beating COVID-19. Remember, it's a sneaky opponent. We don't want to make the same mistake we made last year, and that's the important takeaway from this discussion. Thank you so much to all of you for joining us this evening. That's all the time we have on the India Development Debate, but we'll be back tomorrow, same place, same time. See you then.